So here is the 6-step protocol, which has the rather inelegant and threatening acronym SPIKES. At least that has the virtue of being easy to remember. Let's start with a simple definition of bad news. Bad news can be defined as any news that seriously and adversely changes the patient's view of his or her future. In other words, bad news is the gap between the patient's expectations and the reality of the patient's medical condition. And that gives us a very important pointer. You can't tell how bad any bad news is and how badly it may affect the patient unless you have already got some idea of what the patient's perceptions and expectations of the situation are. As you're going to see in a moment, this point is built in to the 6-step protocol. It actually makes up the pivotal point of the interview, step 2 and step 3 of the 6 steps. To put it in a nutshell, it means that before you tell a patient the bad news, you need to ask them what they know or suspect about the situation so far. What we're going to do now is very quickly go over each of those 6 steps in the SPIKES and show you how this approach is actually a variation on the standard approach to the medical interview, the CLASS. Then we're going to go on to see some examples. Step 1, the first S of SPIKES, is setting. And we mean by that getting the setting right, which we called context, physical context in the class system, and then starting off the interview with all your listening skills and facilitation techniques going to make sure that you are being perceived as an effective listener. So this step then comprises all those various techniques we discussed in the C and the L sections of the class CLASS approach. And that means sitting down, sitting close to the patient, getting obstructions out of the way, keeping eye contact, switching your listening skills on, silence when the patient's talking, facilitation techniques, including nodding, pausing, and repetition. All of that, then, is included in the S setting of SPIKES. Then comes the first really important part of breaking bad news, assessing the patient's perception of his or her medical situation. The P stands for perception. What you want to know here is how serious the patient thinks the situation is. To do that, you can use one of many different phrases, such as, when you got that chest pain, or when you found that lump in your breast, what did you think was going on? Or, what did you make of these symptoms when you first noticed them? And as the patient replies, listen carefully to 2 aspects of that reply. Listen to the level of comprehension, and also listen to the vocabulary that this particular patient is using. Both of these are going to affect how you handle the interview in 2 ways. First, if the level of comprehension is clearly near the medical facts, then you're going to have less educating work to do. Whereas if the patient has no idea, for example, what a shadow on the X-ray actually signifies, then you're going to have a lot of work to do. And secondly, when you start explaining, it's helpful to begin by using the same sort of vocabulary as the patient. If the patient says shadow, you start with shadow. If the patient says, I know it's ductal carcinoma in situ, then you start there. So that's the P for perception stage. Ask what the patient perceives and listen to the comprehension and vocabulary as the patient replies. If the patient says he or she doesn't know anything, accept that exactly as you would accept a symptom and just note it at this stage. Then comes the pivot of the whole interview when you ask the patient what he or she would like to know about the medical situation. Hence, I for invitation, getting a clear invitation to discuss the medical information if that's what the patient wants. As you'll see in the scenarios that follow, there are lots of different ways of actually phrasing this. Are you the sort of person who would like the full details, for example? Or even, how would you like me to handle the information? Do you want me to tell you the full details, etc., etc.? The exact phrase is not so important. What matters is that you ask. Neither the patient nor you will ever forget that at that moment the patient had a true choice and that you were sensitive enough to ask about it. If the patient, as happens very rarely these days, says, "No, I don't want to know," then offer to talk to a relative or friend and tell the patient that you'll always answer questions later on, but you won't thrust unwanted information down their throats if they don't want it. Many of these patients will later indicate that they would like information after all. So that is the I of spikes. Get a clear invitation. Then K for knowledge, giving the patient the information. Few simple rules: give the information in small chunks and always check that the patient understands what you are saying after each small chunk. And the K for knowledge goes on simultaneously with the E for empathy. As you talk, you listen. And as you listen, you acknowledge and respond. So the E is for empathize. And of course, the patient is going to react and respond to the information that you're giving. As they do so, you have to acknowledge and respond to their reactions. That's what we called in the CLASS class approach, A for acknowledgement. The heart of this, as we discussed then, as you're going to see in the scenarios that follow, is the empathic response. In many respects, your ability to acknowledge, empathize with the patient's emotions is the single most important characteristic of good and supportive news breaking. Without it, you're going to appear insensitive and of little support. With it, you may well be perceived as a perceptive and supportive clinician. And then, at the end of the interview, as in all medical interviews, agree on the strategy and summarize. As in the 2 S's of CLASS, the class system, you have to propose a strategy, summarizing and clarifying as necessary, and then close the interview with a summary of the ground covered in your discussion, an offer to the patient to raise any other major, important, urgent issues that need to be discussed. Even if you can't discuss them at the moment, at least you can set the agenda for the next meeting. And finally, a clear contract for the next contact. In other words, a clear who does what. So that is the basic 6-step spikes protocol for breaking bad news. And as we said, it's a variant on the CLASS class basic strategy. Now we're going to see some examples of how this can be helpful in real life, as it were, in unrehearsed scenarios with simulated patients.